Have you ever woken up feeling just a little off? Maybe a touch of dizziness, a weak grip, or a moment where your words didn't come out quite right, and brushed it off as just another part of getting older? What if I told you those small, everyday moments could be your brain's urgent warning signs, silently building toward a stroke that could steal your independence, your memories, and your freedom? As a brain doctor with over 3 decades of experience, I've seen too many seniors unknowingly increase their stroke risk every single morning through habits they don't even think twice about. In this video, I'm revealing the top daily habits that are quietly putting your brain in danger and the simple changes you can make tomorrow to protect your mind, balance, and future. You need to watch this until the end because by doing so, you'll not only learn to spot the hidden warning signs of stroke but also discover exactly how to transform your morning routine into a powerful shield that could save your life and keep you thriving for years to come. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Ignoring morning dizziness or weakness. It begins with something so subtle, so seemingly inconsequential, that most older adults barely give it a second thought. You wake up in the morning, and as you swing your legs over the side of the bed, the room spins for a moment. Perhaps your legs feel wobbly, like they're not quite ready to carry you. Maybe your hand fumbles with the coffee mug, weaker than usual, or your words come out slightly slurred, as if your tongue is tripping over itself. You pause, take a deep breath, and tell yourself, this is just what happens when you get older. You shake it off, maybe sit for a minute, and carry on with your day. But let me be clear, this is not a normal part of aging. As a neurologist with over 2 decades of experience, I've seen this scenario unfold far too often, and I'm not here to alarm you unnecessarily. I'm here to protect you from a potentially devastating oversight. Let me share the story of Mr. Harold James, an 82-year-old retired firefighter from a small town in Indiana. Harold was the picture of resilience, a man who'd spent his career saving lives, who still mowed his lawn, drove himself to the grocery store, and spent every Saturday casting lines with his grandson at their favorite fishing spot. One crisp autumn morning, Harold woke up feeling a little off. His left hand didn't grip his morning coffee mug quite right. It felt clumsy, almost foreign. He chalked it up to arthritis or perhaps sleeping in an awkward position. He didn't mention the faint tingling in his cheek or the brief moment when his vision seemed blurry. He didn't call his doctor. He didn't jot it down in a notebook. He didn't think it was worth mentioning to his wife. 2 days later, Harold collapsed in his kitchen, the victim of a massive ischemic stroke. The blood flow to his brain had been blocked, starving critical areas of oxygen. By the time he reached the hospital, the damage was done. His entire left side was paralyzed. His ability to speak was gone. The fishing trips with his grandson, the drives to the store, the independence he'd cherished, they were all stolen from him. Today, Harold resides in an assisted living facility, not because he was frail or careless, but because he ignored the warning signs his body was screaming at him. What Harold experienced that morning wasn't just a quirk of aging, it was likely a transient ischemic attack, TIA, often referred to as a mini-stroke. A TIA is your brain's desperate cry for help, a temporary blockage of blood flow that resolves quickly but leaves a dangerous message. A major stroke may be imminent. According to the American Stroke Association, approximately 1 in 3 people who experience a TIA will suffer a full-blown stroke within a year, with the highest risk in the first 48 hours. These warning signs, dizziness, weakness in one arm or leg, slurred speech, facial numbness, or sudden vision changes, tend to strike in the early morning. Why? As you transition from sleep to wakefulness, your blood pressure naturally rises, a phenomenon known as the morning surge. For older adults, whose blood vessels may already be narrowed or less elastic due to age or conditions like hypertension, this surge can strain the brain's delicate vascular system. Your blood is also thicker in the morning, as dehydration sets in overnight, and your brain is still recalibrating from the metabolic shifts of sleep. This creates a perfect storm of vulnerability. The tragedy isn't the symptoms themselves, it's that they're so often dismissed. Seniors tell themselves it's a senior moment, a fleeting inconvenience, or just fatigue. But a senior moment can escalate into a life-altering catastrophe if ignored. I urge every patient to adopt a simple protocol. If you wake up feeling off, take it seriously. Document the time, the sensation, and its duration. Look in a mirror and smile. Does one side of your face droop? Raise both arms. Does one drift downward? Say a simple sentence like, "The sky is blue." Is your speech clear? These are the components of the FAST test: face, arms, speech, time. A quick way to assess stroke risk. If anything feels abnormal, even if it resolves within minutes, call your doctor immediately. If you have a loved one who brushes off these symptoms, don't let them. The cost of waiting is far too steep. A stroke doesn't just damage your brain. It robs you of your mobility, your independence, your ability to make new memories, and the joy of everyday moments with those you love. Once those are lost, they may never fully return. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 2. Skipping or mismanaging your morning medications. If you're prescribed medications for blood pressure, cholesterol, blood thinning, or heart rhythm control, let me be unequivocal. How you take these pills can mean the difference between a healthy morning and a life-changing stroke. Skipping a dose, taking it late, or doubling up to make up for a missed day isn't just a minor slip. It's like leaving the door to your brain's defenses wide open. I once treated a patient named Mrs. Evelyn Carter, a 76-year-old retired nurse from rural Georgia. Evelyn was sharp, independent, and well-versed in healthcare from her years in the profession. She'd managed her high blood pressure with daily medication for over a decade, and her condition was stable. But living alone after her husband's passing, she sometimes forgot her morning dose. It's just one day, she'd tell herself, and to compensate, she'd take 2 pills the next morning, thinking it would balance things out. One morning, after missing 2 consecutive days of her blood pressure medication, Evelyn woke up with a pounding headache and difficulty forming words. She tried to call her daughter but couldn't get the words out clearly. By the time paramedics arrived, she was in the throes of a hemorrhagic stroke, a brain bleed caused by a blood pressure spike that her medication was meant to prevent. The double dose she took that morning, in an attempt to catch up, only exacerbated the problem, causing her blood pressure to swing dangerously. Evelyn survived, but she lost her ability to speak fluently for nearly 6 months. She required extensive rehabilitation to regain basic functions. That single misstep, born of good intentions and a belief that one missed dose wasn't a big deal, changed her life forever. As a neurologist, I've seen this pattern repeat countless times. Older adults, often with the best intentions, underestimate the precision required when taking medications that protect their cardiovascular and neurological health. The morning is a particularly critical time for your brain. As mentioned earlier, the morning surge in blood pressure places extra stress on your blood vessels. For seniors, whose arteries may be stiffened by age, plaque buildup, or chronic conditions like hypertension or diabetes, this natural rise can push fragile vessels to the breaking point. Medications like beta blockers, ACE inhibitors, statins, or anticoagulants are carefully timed to blunt this surge, stabilize blood flow, and prevent clots or vessel ruptures. But if you skip a dose, take it hours late, or stop altogether because you feel fine, you're leaving your brain vulnerable at its most fragile moment. What compounds the problem is how medications are sometimes taken. Some seniors swallow their pills without water, which can delay or reduce absorption. Others take them with coffee or grapefruit juice, unaware that these can interfere with how the body processes certain drugs, potentially reducing their effectiveness or amplifying side effects. For example, coffee can enhance the effects of some blood pressure medications, leading to dangerously low pressure, while grapefruit juice can dangerously increase the levels of statins in your bloodstream. Even more alarming, some patients stop their medications entirely because they felt fine for a few days or weeks, not realizing that their stability is because of the medication, not despite it. Here's a critical truth. Taking your medication incorrectly can be as dangerous as not taking it at all. Doubling up on a missed dose, especially with blood thinners like warfarin or antihypertensives, can cause your blood pressure to plummet, leading to dizziness, falls, or even internal bleeding. Conversely, missing doses allows your blood pressure or cholesterol to creep up, silently eroding the protective barriers around your brain. A stroke doesn't care how you felt yesterday. It's the cumulative effect of inconsistent medication use that sets the stage for disaster. Protecting yourself is simpler than you might think, but it requires discipline. Use a pill organizer to track your doses. Set a daily alarm on your phone or clock to remind you of your morning routine. If your regimen feels complicated, ask your doctor or pharmacist to simplify it. Perhaps by switching to a once-daily formulation or aligning doses with your daily habits. Swallow your pills with a full glass of water, not coffee or juice, and take them at the same time each day to maintain steady levels in your bloodstream. Consistency isn't about perfection. It's about building a fortress around your brain, one dose at a time. Because every morning you take your medication correctly, you're not just checking a box. You're standing between yourself and a catastrophe. But even those who manage their medications diligently may unknowingly sabotage their efforts with a morning ritual that feels harmless but carries hidden risks. That first cup of coffee. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3. Drinking coffee on an empty stomach. For millions of older adults, the day doesn't truly begin until they've poured that first steaming cup of coffee. It's a ritual steeped in comfort, routine, and even nostalgia. The rich aroma, the warmth of the mug, the jolt of energy that signals the start of a new day. But when you drink coffee on an empty stomach, especially before water or food, you may be triggering a cascade of physiological stress that puts your brain and heart at risk. The consequences can be far more serious than a fleeting caffeine buzz. Let me tell you about Mr. Charles Lee, a 77-year-old Korean War veteran from Tucson, Arizona. Charles was a creature of habit, proud of his disciplined lifestyle. Every morning for decades, he'd start his day with 2 large cups of black coffee, always before eating breakfast. "It keeps me sharp," he'd say with a grin. But one morning, after his usual coffee ritual, Charles felt his heart racing, as if it were pounding out of his chest. His vision blurred, and a wave of nausea hit him. Moments later, he collapsed, unable to stand. At the hospital, we diagnosed a transient ischemic attack, TIA, a mini-stroke caused by a temporary disruption in blood flow to his brain. Tests revealed that his morning coffee habit, combined with undiagnosed atrial fibrillation and mild dehydration, had sent his blood pressure soaring and his heart rhythm into chaos. That single cup, sipped on an empty stomach, had pushed his already fragile vascular system over the edge. Caffeine is a powerful stimulant, and when consumed without food, it's absorbed rapidly, hitting your system like a sledgehammer. In older adults, whose blood vessels are less flexible and more prone to narrowing, this can have serious consequences. Coffee on an empty stomach can constrict blood vessels, spike adrenaline levels, elevate heart rate, and cause blood pressure to surge suddenly. For someone with conditions like hypertension, atrial fibrillation, or even early-stage vascular disease, this jolt can reduce blood flow to the brain, starve it of oxygen, and trigger a TIA or worse, a full stroke. The morning, as we've discussed, is already a vulnerable time due to the natural rise in blood pressure and thicker blood from overnight dehydration. Adding a large dose of caffeine to this mix is like pouring fuel on a smoldering fire. What's more, coffee can mask critical warning signs. That burst of energy you feel might obscure symptoms of fatigue, dehydration, or low blood sugar, conditions that already stress your brain and heart. Over time, the repeated strain of caffeine-induced spikes in cortisol, the stress hormone, heart rate, and blood pressure wears down the protective lining of your blood vessels, increasing the risk of plaque rupture or clot formation. For seniors with undiagnosed or poorly managed conditions, this isn't just a theoretical risk, it's a daily gamble. I've had patients who swore their morning coffee was harmless, only to discover it was a silent contributor to their stroke risk. The solution isn't to swear off coffee entirely. Moderate consumption can have benefits, including improved alertness and even some cardiovascular perks when timed correctly. But the key is balance and timing. Start your day with a glass of water to rehydrate your body after sleep. Follow it with a small, balanced breakfast, a slice of whole grain toast, a boiled egg, a piece of fruit, to stabilize your blood sugar and cushion the impact of caffeine. Only then should you sip your coffee, ideally limiting it to 1 8-ounce cup with minimal sugar or creamer. Decaf or half-calf options can further reduce the strain on your system. By respecting coffee's power, you can enjoy its benefits without endangering your brain. The hard truth is this: that comforting cup of coffee, when consumed carelessly, can become the spark that ignites a neurological crisis. Your brain doesn't crave caffeine, it craves oxygen, hydration, and stability. Don't let a beloved ritual become the moment that tips the scales toward disaster. 4. Holding in your morning urine. It's a habit so ingrained in daily life that it barely registers as a choice. Waking up, feeling the urge to urinate, and deciding to hold it in while you start your morning routine. For many, this means checking emails, scrolling through news on a tablet, brewing coffee, or simply lingering in the comfort of routine. Most people, especially older adults, don't give this decision a second thought. But what seems like a minor, harmless delay can have profound and dangerous consequences for seniors. Holding in your morning urine isn't just a matter of convenience. It's a subtle but significant risk factor that can elevate blood pressure, strain the heart, and set the stage for life-altering conditions like stroke. To illustrate the gravity of this habit, let me share the story of Mrs. Darlene, a 79-year-old widow from a small town in Indiana, whose morning routine nearly cost her everything. Mrs. Darlene's mornings followed a predictable rhythm. She'd wake up, prop herself up in bed, and reach for her iPad to catch up on emails and news. She enjoyed this quiet time, savoring the slow start to her day. Coffee came next, brewed deliberately, sipped while she sat at her kitchen table. Only after this ritual, sometimes 30 minutes or more after waking, would she visit the bathroom. She never felt rushed, and she liked it that way. What she didn't know, and what no doctor had ever explained to her, was that this routine was silently building pressure in her body, not just in her bladder but across her entire cardiovascular system. One fateful morning, after a restless night and a second cup of coffee, she stood up from her chair and suddenly collapsed. Paramedics later confirmed she had suffered a hypertensive crisis, a dangerously high spike in blood pressure that triggered a small ischemic stroke. Though she survived, the stroke left her with impaired balance and a lingering sense of fragility. "I thought holding it was just a bad habit," she confided later, her voice tinged with regret. "I never imagined it could be a medical emergency." To understand why this seemingly innocuous habit is so risky, let's explore what happens in the body when you delay urinating first thing in the morning. When you wake up, your bladder is often full from hours of overnight urine production. This fullness sends a signal to your brain, prompting the urge to urinate. Ignoring this signal doesn't just cause discomfort, it activates a cascade of physiological responses that can stress your entire system. A full bladder is perceived by the body as a form of internal stress, triggering the release of stress hormones like cortisol and adrenaline from the adrenal glands. These are the same hormones that surge during a fight-or-flight response, preparing the body for action by narrowing blood vessels and increasing heart rate. The result is a measurable rise in blood pressure, which can be particularly dangerous for older adults, especially those over 65, who may already have underlying conditions like hypertension, atherosclerosis, or heart disease. This rise in blood pressure doesn't stay confined to the bladder. It reverberates through the cardiovascular system, forcing the heart to work harder to pump blood through constricted vessels. The arteries in the brain, which are often already stiffened or narrowed by age or plaque buildup, are particularly vulnerable to this increased pressure. In some cases, a vessel may rupture, causing a hemorrhagic stroke, or a clot may form, leading to an ischemic stroke. These events can occur with little warning, all because you delayed a trip to the bathroom by 10 or 20 minutes. Moreover, a distended bladder can also disrupt the heart's electrical activity, potentially triggering atrial fibrillation, a chaotic, irregular heartbeat that significantly increases the risk of blood clots traveling to the brain. Studies suggest that atrial fibrillation is a leading cause of stroke in older adults, and seemingly minor triggers like a full bladder can tip the scales in susceptible individuals. The risks are compounded by other common morning factors. Many seniors wake up slightly dehydrated, as the body continues to produce urine overnight without fluid intake. Dehydration thickens the blood, making it harder to circulate and increasing the likelihood of clot formation. Add in the effects of caffeine, which further raise blood pressure and act as a diuretic, and the morning delay becomes even more perilous. For Mrs. Darlene, the combination of poor sleep, dehydration, and coffee likely amplified the stress her body was under, turning a routine morning into a medical crisis. The tragedy of this habit is its deceptive simplicity. We're often told to listen to our bodies, but as we age, many of us grow accustomed to ignoring subtle signals, dismissing them as normal or unimportant. The urge to urinate may feel like a minor inconvenience, easily postponed in favor of checking a phone or starting the day's tasks. But for older adults, these small decisions can accumulate into significant risks. The good news is that this habit is entirely preventable. The next time you wake up with a full bladder, don't delay. Put down your phone, skip the coffee for a moment, and head to the bathroom. This simple act isn't just about comfort, it's about protecting your brain, your heart, and your future. By responding promptly to your body's signals, you can reduce stress on your cardiovascular system and lower the risk of a catastrophic event. Because when your bladder speaks, your brain is listening, and ignoring it could come at a far greater cost than a brief interruption to your morning. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Rising too quickly from bed, a silent threat to your brain. There's another morning habit, equally common and even more automatic, that poses a serious risk to older adults: jumping out of bed too quickly. For many seniors, the act of waking up and standing is a reflex honed over decades of purposeful mornings. You open your eyes, swing your legs over the side of the bed, and stand up, ready to start the day. It feels instinctive, a symbol of independence and energy. But what most people don't realize is that this rapid transition from lying down to standing can be one of the most dangerous moments of the day, especially for those over 65. In the first 10 seconds of standing, your brain may be at its most vulnerable, and a single misstep can lead to dizziness, fainting, falls, or even a stroke. To highlight the stakes, let me tell you about Mr. Ray, a 74-year-old farmer from Iowa, whose lifelong habit of rising quickly led to a devastating morning. Mr. Ray was a man of routine, shaped by years of early mornings on his farm. He prided himself on never lingering in bed, viewing it as a sign of weakness. Each day, he'd wake before dawn, sit up swiftly, and stand to start his chores. But one morning, something went wrong. After standing up, he took a few steps toward the kitchen and collapsed. His wife found him on the floor, unable to speak, his face drooping on one side. At the hospital, doctors diagnosed a left-sided ischemic stroke, likely triggered by a sudden drop in blood flow to his brain. An MRI revealed multiple tiny infarcts, silent strokes that had occurred in previous mornings, unnoticed but damaging. For Mr. Ray, that collapse was the culmination of a habit he'd never questioned. The tragedy was not just the stroke itself, but the realization that it could have been prevented with a simple change, taking 90 seconds to rise more slowly. To understand why getting out of bed too quickly is so risky, we need to examine the body's response to this sudden change in position. During sleep, your body is in a state of relative rest. Your blood pressure is lower, your heart rate is slower, and your brain has been comfortably horizontal for 6 to 8 hours. Blood is distributed evenly, and circulation is steady. When you sit up or stand abruptly, gravity pulls blood downward, away from the brain and toward the lower body. In younger, healthier individuals, the body compensates instantly through a process called the baroreflex, which adjusts blood pressure and heart rate to maintain cerebral blood flow. But in older adults, this reflex is often impaired. Age-related changes, such as stiffened arteries, reduced blood volume, or weakened heart function, can slow the body's ability to adapt. Common medications, like diuretics or blood pressure drugs, can exacerbate the problem, as can dehydration or poor sleep. The result is a condition known as orthostatic hypotension, a sudden drop in blood pressure that starves the brain of oxygen. Orthostatic hypotension is surprisingly common, affecting up to 30% of adults over 65, and its effects can be immediate. Within seconds of standing, blood flow to the brain can decrease by 20% or more, causing symptoms like lightheadedness, blurred vision, or a sense of floating. For most, these sensations pass quickly, but for others, they can lead to fainting or falls. Falls are a leading cause of injury in older adults, with 1 in 5 resulting in serious outcomes like hip fractures, which carry a 20% mortality rate within a year. But the risks go beyond physical injury. A sudden drop in cerebral blood flow can also trigger a stroke, particularly in those with pre-existing vascular issues. If a clot is already present or an artery is narrowed, even a brief reduction in blood flow can be enough to cause an ischemic event, as it did for Mr. Ray. What makes this habit so insidious is its timing. The morning is a vulnerable period for the brain, as the body transitions from rest to activity. Your heart isn't yet fully primed to pump blood against gravity, and your brain is recalibrating for the day's demands. Standing too quickly asks your cardiovascular system to perform a high-stakes task before it's ready, and for those with underlying conditions, the result can be catastrophic. Yet, like delaying urination, this habit is entirely preventable with a small adjustment. Here's what I recommend to every senior I work with. When you wake up, pause. Take 3 slow, deep breaths to signal your body to prepare. Gently wiggle your fingers and toes to stimulate circulation. Sit up slowly, resting on the edge of the bed for 30 to 60 seconds. Then, when you feel steady, stand gradually, using a bedside table or chair for support if needed. These 2 minutes of patience can mean the difference between a safe start to your day and a life-changing emergency. A morning routine that protects your brain and your future. The habits we've discussed, delaying urination and rising too quickly, are just 2 examples of how small, everyday choices can have outsized consequences for older adults. Your morning routine is more than a series of tasks. It's a critical window that can either strengthen your brain or erode it day by day. After decades of working with aging patients, I've seen firsthand how strokes and other neurological events often stem not from dramatic incidents but from quiet, repeated oversights. A stroke doesn't always announce itself with fanfare. It can begin with a moment of dizziness you brush off, a full bladder you ignore, or a rushed rise from bed because it's how you've always done things. But as you enter your 60s, 70s, and beyond, your body demands a different kind of attention. Ignoring its signals doesn't just risk your health, it threatens your independence, your memories, and the life you've worked so hard to build. You've likely spent decades caring for others, raising children, supporting a spouse, serving your community. Now, it's time to care for yourself with the same dedication. You deserve to enjoy your later years with mental clarity, physical stability, and the freedom to savor life's moments. That starts with respecting your brain, especially in the first minutes of each day. The steps are simple but powerful. Respond promptly to your bladder signals, rise slowly from bed, stay hydrated, take medications consistently, and pay attention to subtle symptoms like dizziness or fatigue. These aren't trivial suggestions. They're evidence-based strategies that can extend your life and preserve your quality of life. I've witnessed patients who, by making these small changes, added 10 or 15 years of vitality to their lives, remaining active, engaged, and present for their families. I've also sat with families who wished their loved ones had known sooner. Don't let that be your story. Tomorrow morning, when you wake, take a moment to breathe, move with intention, and honor your body's needs. These choices aren't just for you. They're for the people who love you and want countless more mornings by your side. Every stroke prevented is a life preserved, and every mindful morning is a step toward a longer, brighter future. Thank you for watching this video and taking the first step toward protecting your brain and your future. Your morning habits hold the power to shape the rest of your life. And by being here, you've shown you're ready to listen to your body and make small changes that can lead to big results. Now, I'd love to hear from you. What's one thing you've learned today that's opened your eyes about your daily routine? Maybe it's the importance of taking your medications on time, sipping water before coffee, or pausing before jumping out of bed. Whatever it is, share one thing you've learned and plan to bring into practice in your life by commenting below this video. Your story could inspire someone else to take action, too. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more practical tips to keep you thriving. Here's to stronger mornings and a brighter, healthier future. Let's do this together.